All right, ambulatory surgery. Now, this is what you've been working in the virtual internship. But we have a guideline, and what it tells us is you're going to code the diagnosis for which the surgery was performed. If the post-op diagnosis is different from the pre-op at the time, then you're going to select the post-op since it's more definitive. The examples here, pre and post-op diagnosis are the same. Patient had an EGD for upper GI bleeding. The post-op is upper GI bleeding, etiology undetermined. The physician could not determine the reason for the bleeding. So your GI bleeding is going to be your first listed diagnosis. And what about the patient that has the EGD for GI bleeding and the physician determines that the bleeding is due to a gastric ulcer? There is a code for a combination gastric ulcer with hemorrhage. That's going to be what you assign as your first listed diagnosis. This one you pretty much, you've worked in the virtual internship, you're familiar with what to assign first. It's just something to remember when you're out there coding for your physicians, that you want to make sure that you pick up the post-op and not the pre-op diagnosis.